Impact of COVID. Obviously, it's been devastating.
The economic loss, the physical loss of lives. It's been really hard for people to deal with it, even culturally, physically, in so many ways. I mean, I can go on about the statistics about, what kind of setbacks it's had for the world. But the most profound setback, at least in my context, has been about immunization, right? So Bill Gates said this, 25 years of progress, we had setbacks in 25 weeks.
Of COVID, because governments were all about making sure that we had coverage, vaccine coverage, and vaccine coverage is really critical because you get herd immunity and everything, and all the gains that we made for literally almost 3 decades, we lost in 25 weeks. And now people are thinking about what it means to bring back that, right? So routine immunization in many countries is like DTP3 coverage. That dropped by 5%. And what's really striking is that vaccination of missed vaccines, so kids who had access to vaccines but missed it, that increased from 19 million kids to 23 million kids. And zero dose children who we give like polio, that's normally what you give at zero dose, that increased from 13 to 18 million. So there's a lot to be done, a lot of lost ground to regain, to be honest. I might sound a little self-serving, but immunization is literally the best health intervention next to clean water, right? It's the biggest bang for buck that you can give kids. It's the biggest investment that you can make in health. And there are a lot of studies that have showed how much return immunization can give when you look at not just prevention per se, because that's the most obvious return, but if you look at a loss of days, a loss of school, and all of that, it is the best investment that one can make. Any prizes for guessing what is the largest cause for indebtedness in our country? Yeah, it's not, it's healthcare costs. It's the biggest reason people go into debt. So immunization not just alleviates disease, in my mind it alleviates poverty, because you prevent disease and then you prevent all these people from having indebtedness. So here is what immunization did for the world. Right? Sorry, it's a lot of moving balls here. But if you look at DTP3 coverage over time, and you look at the reduction of childhood mortality on the other axis, there is a direct correlation between vaccine coverage and childhood mortality. And this is made even more acute, like if you look at Hib vaccine, it's the same thing. You will see between 1990 and now how coverage for vaccines has directly impacted childhood mortality. But what most people don't realize is that everyone had a lot of kids in the past because they didn't survive. And when they started surviving, in large part because of clean water and vaccines, people started having fewer children. And the fewer children meant larger number of resources and investment into those children. So there is a direct correlation between having healthy kids who survived and the economic growth of countries. And that's proven again statistically over decades. Okay, so 326, again, what's 326? Any prizes for guessing? That's the number of days between sequencing SARS-CoV and making a vaccine. Okay, so that's how long we took as an industry to make a COVID vaccine, which is unprecedented. So 326 days, unprecedented. I don't think you will see that happening again ever. Because this is what it takes to do preclinical animal, research in animal models, proof of concept. Then you take it to phase 1 where you show safety. Then you take it to phase 2 where you show that this dose is effective. Then you take it to large scale field trials in phase 3. But we had to do all of that literally back to back. And that's how it took just 326 days to make a COVID vaccine. And it's normally, like I said, you have, so much analytical development and everything that, that this was really something remarkable, at least for me. And some of the reflections that we've had, thanks to all of this. So on the positive side, unprecedented level of collaborations. I mean, we worked with, like I said, in addition to making our own vaccine, we partnered with Janssen, we made their product. And large companies are really paranoid about IP and all of that. So the fact that they came forward and they said, look, we need to do this meaningfully in a time frame that makes sense was again remarkable. So I think we've seen unprecedented level of partnerships and collaborations and even innovations. Whoever heard of mRNA vaccines before this, right? But it was a platform that people were investing in for decades. And yet the pandemic presented an opportunity for this to be tried out in large scale trials, and it is going to transform the way not just vaccines get discovered, but also how therapeutics get discovered, particularly cancer care and everything. So again, we saw tremendous innovation happening, government policies. So I've been working with the government for 20 years now, right? Not trying to give my age away, but yeah, and I have to say I've never seen government come together so strongly. And, and we had to deal with not Ministry of Health, because that's a more obvious thing, but right now we deal with Ministry of External Affairs, Biotechnology, and all of them came together to sort of facilitate regulation, facilitate exports, facilitate imports when the supply chain was disrupted, because we saw that as well. So there's just been a lot of speed, particularly in avenues that you didn't expect speed or agility. But on the negative side, we did see disruption in supply chains. We did see countries become very national and say that my citizens, my own first, including the US, including India. And, so it alerts you to the fact that you are part of a global supply chain. And you have to be alert to the fact that that can get disrupted out of reasons completely outside of your control. So we did see that. Manufacturing costs increased because of all of the reasons I talked about. And access to funding, surprisingly, it's like, again, in the US and Europe, you had companies that had real access to what I call push funding, right? So they had access to R&D funding, but they had access to pull funding also in terms of market mechanisms, where these governments said, if you make a vaccine, we will buy X amount, in addition to giving R&D funding. That was very much lacking in our context, so the challenges were that much more. So this is a busy slide, but in a sense, I think the heart of healthcare is in basic healthcare. We need to really enhance public spending, particularly in our country, right? So a lot of people say we increased from 1% GDP to 1.6. It's nothing. It's nothing. I also think that it's impractical to think 16% of GDP spent in healthcare in the US. That's absurd. They're being completely inefficient. But with our capabilities, our technology, I think getting it up to 3% to 4% is meaningful. But we also need to invest in public health centers. We need to make sure that we increase the supply of talented people like nurses, doctors, and also make sure that the health delivery is much more accessible, because there's no insurance to speak of, right? So the health coverage is very poor. And you have lifestyle diseases. People have diabetes, they have cancer. And just because it's not a burden on the government system doesn't mean it doesn't exist. So the best thing would be to make wise investments in pure public health. But it's frankly not a sexy topic. It's not what wins elections. But it's really incumbent, I feel, and a moral responsibility on us to make sure that we deliver healthcare that's accessible to everybody. It shouldn't be a privilege. It should be a right. It should be a point of equity for everybody to have access to healthcare. I feel quite privileged to be in a business where vaccines are distributed so equitably and they're free of cost. So makes me feel proud to be some small part of that ecosystem. When you think about push and pull mechanisms, like I said, there's not that much public spending in healthcare or in innovation. So it's again a private enterprise. It's about entrepreneurship. But whoever's been an entrepreneur will know entrepreneurship is a business of failure more often than not. So you have to have the courage to believe in sort of this dream. Okay, so I'm hoping this works. I have a small video. Yeah.
We need to make the vaccines affordable. And the whole world is looking at India for cost-effective vaccines.
This is my personal commitment, making a product and delivering a product to children in all countries that are needing it.
A healthy child can make healthy family. A healthy family can make a healthy nation.
This is one of the very few industries where we are impacting patients' lives every day. I take a lot of pride in working for biology.
It is certainly a matter of pride and privilege for me to be able to make something that touches billions of lives in my lifetime.
Thank you. You know, I just have to end by saying that this video wasn't made by us. It was made by the Gates Foundation for us. So I don't feel so bad in sharing that. I'm happy to take questions, but that's all I have for today. Thanks so much for having me.